Welcome to the Dr. Greg Show, October 18th, 2025. Hope everyone is having a good day. Hope your day is going well. We have a lot to go over. It's going to be fun. We have some stories we want to talk about. Also, Collins. We'll see how that goes. But, what was the one thing that I wanted to learn? So we have some ideas, some posts, the No Kings protests. We can talk about that. And the Texas Department of Health. We're going to deep dive that tonight, guys. I just learned that there's over 800 active cases of measles still in Texas. I thought it was like they had declared it over and it was done. So I'm shocked that there's so many and that they are not actually following it. So, I got my flu vaccine Thursday. Stella, you are a legend. You are awesome. All right, guys. Good job, Stella. All right. So that means 773, guys. In 3, 2, 1. Good job, Stella. Good job, Stella. We appreciate you. We love people who get vaccinated here. We celebrate every single shot, every single time. Because you're protecting yourself, you're protecting the people around you. Getting vaccinated is pro-life and patriotic. Make America vaccinated again, guys. Let's do it. Get those vaccination rates up. Get it up. We're going up, up, up. It's going to be golden. You know that we're going to be glowing. Oh, vaccine. Sponge, I think that it is patriotic because you're looking out for one another and you're creating a better and healthier nation. So I do think that it is definitely patriotic. Nice, Julie. Good. Yes, exactly. Vaccines are going up, up, up. All right, guys. So, first up, I guess I could, it's a personal choice, Sponge. You know, everyone has that choice, and that's what's amazing is that everyone, if you want to, minimize your risk to long COVID, and transmissible diseases, it's definitely the way to go. Masking is obviously the right choice if you want to minimize your risk. So, I still mask like in really high trafficked areas like airports. You definitely want to still mask. Absolutely. And there's nothing wrong with it. I mean, if someone's wearing a mask, maybe they live with an immune compromised person. Maybe they are immune compromised themselves. So we should encourage people to wear a mask if they're feeling sick too. You know, it's all good. So I think that's a good way to be. Hi, Jude. How's it going? Oh, there you go. That also works, Elaine. It's not a communicable disease, but it is something. Yeah, exactly, Sponge. I gotcha. Sponge, how many vaccines did you get? You didn't tell us, so I don't know. I didn't know how much to add. You said you got a vaccine, though. I guess he's used the singular vaccine, so I guess one. COVID. All right, Sponge, legend. 774 for Sponge in 3, 2, 1. Yes. Good job, Sponge. You're awesome. Thank you for getting vaccinated. We appreciate you. In this community, we celebrate every single shot, every single time. I know, Kathleen. I don't understand it either. I don't get it. I think that healthcare workers should always be having to mask. I don't think that the healthcare workers should ever have the choice to not mask. It blows my mind that I got vaxxed for both flu and COVID a few weeks ago. Okay, nice, Elaine. Nice. 776. Let's go. In 3, 2, 1. Elaine, go. Good job. Okay, Karen, you're selfish. I don't think you have to tell us, but it's okay. You know, you can change. You can still get vaccinated and change that. You don't have to be. You're not. You're not tied down to that position. So, vaccines are safe and effective, and you can change at any time. You can get vaccinated at any time. Eileen, thank you. Thank you for correcting. Yeah, absolutely. You're selfish if you don't get vaccinated and you're healthy enough to get vaccinated. Yeah, absolutely. All right. Nice, Jude. Good job. Exactly. That's a good point, Sponge. If vaccines get hours of research by people with PhDs and get funded, then by governments all throughout the world independently, right? I mean, um, they're all doing independent research in order to find that vaccines are safe and effective. So that's awesome. As a nurse that have the 31 years, I'm wrong. I'm wrong on what? I don't understand what you're talking about, workaholic. Yeah, vaccines are safe and effective. That's not how vaccines work, Karen. If you wanted to ask, then you could ask questions. But basically, the more viral genomes out there, the easier it is to evade vaccines. So all you're doing is harming one another if you don't get vaccinated. That's why you're selfish if you don't get vaccinated. And if you're a parent that's not vaccinating your child, I think you're a bad parent too. And you need to think about what kind of parent you want to be in this life, and that's be better. So that's what I think. You're creating a world of privilege, and you're creating a world where it's more dangerous for your child. So therefore, you are inducing harm to your child needlessly. Therefore, you are a bad parent. So that is what it is. You can laughing emoji all you want, but you know that I'm right because you're not requesting and talking right now. Yeah, you're gonna stay there because you're scared. So I don't choose to live in fear of what things that I can change. I try to better myself and better the world around me and give my kids a better future than I had. So by not vaccinating your child, you are making their lives worse in the future. Therefore, you're a bad parent. It's very easy. It's very, very simple. Very straightforward. Exactly. Exactly, Kathleen. What do you think those people that What's up, Kathleen? How's it going? Opinions on polyester. Does it kill testosterone? I don't know, Caleb. I don't know. We'd have to see the studies. Genuinely don't know. Hi, user. How's it going? All right. Yeah, exactly. The reckoning. Exactly. The RFK says that the flu vaccine is safe and effective for kids 6 months and above. The CDC recommends right now, RFK's CDC recommends the flu vaccine for 6 months and above. RFK, in response to the Texas outbreak of over 800 measles positive people, they said that the MMR vaccine is safe and effective. So your anti-vax champion, faced with actual evidence and actual accountability, where he would actually have to be held accountable for his actions as the director of the HHS, caved immediately and supported the evidence that said that vaccines are safe and effective. So that's your champion. That's your champion that is unable to defend any of his own positions when he's held account just the slightest amount. He buckles immediately to what the science is. So that's just what it is. Oh, okay. Oh my gosh, this is amazing. Vanessa, Crystal, my grandmom and I got vaxxed for COVID, flu, and pneumonia. That's nine vaccines, and your baby nephew got their first flu shot. Vanessa, Crystal got 10, guys. Oh my gosh, Vanessa, Crystal, what an incredible person getting their entire family vaccinated. That is incredible. Your grandma, mom, and I, that is an incredible family. That is unbelievably awesome. I love that. Everyone, let's give it up for Vanessa Crystal in chat. Let's spam those V's. This is a big one, guys. This is a good one. Vanessa Crystal in 3, 2, 1. Legend. Legend, Vanessa Crystal. Good job. Let's 2 cheers. Good job. I love it, man. That's so cool. That's so cool. Thank you so much for getting vaccinated. And in 3 generations getting vaccinated together, guys. Incredible. You think that grandma is scared of a little shot? No. My grandma's like, get me in there. Get me in there. She knows. She remembers what it was like. She remembers what polio was like. They lined up around the block in order to get it. They know that vaccines are safe. They know that they're effective against helping people live longer lives, and they love them. I think we could hit 1,000 by the end of the month. It's been so insane that we got 100 in a day last week. That was crazy amazing. I think we are going to do something very special, Sponge. Yeah. Vaccinated against what? I mean, there's 30 diseases that we currently vaccinate against. So, I mean, there's lots. There's lots. Vaccines currently save the lives of 5 million people a year, 4 million of which are children. So that's why vaccines are pro-life. Marissa, welcome in. What are you counting? What am I counting? Oh, this right here. So our vaccines, these are our vaccines. So people come in here that get vaccinated, any type of vaccine, them or their family. We count their vaccinations. And we celebrate them. We celebrate every single time that someone gets a vaccine because vaccines are safe and effective. Your public health is important. We celebrate public health and we love people who get vaccinated. So that's it. That's just it. I know, Diane. Isn't it awesome? Okay. I don't know what you mean, Judy. Nice, Phoenix. Good job. Good job. That my kids and I are fully vaccinated. Phoenix, that means that you're a good parent. And I appreciate you. Okay? Getting vaccinations. There's very few things as a parent that you know that you're doing the right thing on. Right? Kids don't get sent with a manual. That's what everyone says, right? But getting vaccinated on time for your kids is always the right decision, guys. Always the right decision as a parent. Just follow the vaccine schedule, get it done. All the pediatrician appointments done. Easy. I know, Eileen, it's crazy. Eileen, we're going to cover the Texas Department of Health tonight, and we're going to see just what they're doing in order to stymie it. When I was browsing last night, it was just it was declared over like weeks ago. It's like still 800 cases. It's wild. Oh, nice, Tracy. No, this is global. We're talking about global vaccines. So mine won't count, but you got daughter and I had our flu shots. Tracy, good parent. That's 788. Tracy, good job. We're talking global. It all counts here. We appreciate all humanity. 788. Tracy, good job. Good mom. Here we go. 3, 2, 1. Good job, Tracy. Love it. Yeah, we celebrate all vaccines here, all throughout the world. Oh, nice, Sponge. Yeah, I mean, you can just. for the flu vaccine this year, it's specifically really bad for kids. So you're doing a really good job protecting kids this year. Even RFK thinks that it's good. 6 months and above. I have a public health microbiologist. I was a public health microbiologist. My kids are vaccinated, but I don't know. I still don't I don't understand what you're saying, Meg. You don't. Yeah, it's all tested, Meg. It's all tested. So all the everything, the schedule is completely tested and it's completely safe. That you don't have to worry about it. 789, and because of Larry, not that Larry. Nice one. 3, 2, 1. Not that Larry. Good job. Good work. Do you agree double measles vaccination once as a child now that Canada is pushing it again as in 40 now? I mean, it matters what your titer is, guys. If you can get a titer if you're 40 and see if the MMR one is low, and then you just can get another boost. So that's the best and the safest way to go about it. Oh, Meg, there's no problem with the heavy metals. So the amount of aluminum in them is the same as it's actually less than the amount of breast milk. So there's tons of studies now that show that it's completely okay and it's not detrimental at all. Like aluminum is used and found in cellular biology all the time. It's nothing unique or dangerous that they're using. So you can rest easy on that one. I get every year. I get every vax my primary PA recommends, not just for me, but also protect my patients. Exactly, Marissa. Exactly. Oh, what's up, Anthony? Do I remember you? I don't know. I'm glad you remember me, though. The forever chemicals in our water cause more disease than vaccines. I know that's not true. That doesn't make any sense. Yeah, fluoride in our water is completely fine. Yeah, exactly, Eileen. Yeah, they're not even side effects. It's just your body making an immune response to the antigens. So that's the it's totally safe. It's totally safe. You don't get an adverse reaction if you get a fever after a vaccine. That's like the normal state that actually happens in what you want. Exactly, Marissa. Yeah, patient safety is so important. That's why every healthcare worker should be required to get vaccinated. Absolutely. If you don't agree with modern medical science, I don't want you to be a healthcare provider. I'm sorry. I don't care. Sorry. that offends people. I don't care though. Hey, Rapture. Good evening. Exactly, Eileen. Have your children's pediatricians recommended vaccines? Yes, Sponge, of course. I would be leaving my pediatrician if they did not recommend vaccines. Absolutely. Yeah, Nikki. I think you do want a little bit of an immune response. Yeah, but my wife has had no reaction to any COVID shots. I'm floored for like the next day, so it matters. No, you're not, Eileen. You're all good. Don't worry about it. COVID's a very important vaccine to get, Meg, because you're protecting your kids against long COVID. So long COVID is a neurological disorder that we're uncovering that people with COVID have that causes long-term problems like seizures, tremors, vertigo, loss of hearing, smell, all these type of things. And we've had moms come in here that, with their kid who refused to get vaccinated, and then they develop long COVID or they have fatigue. I had one guy last week that came in. He was trying to troll me and make fun of the COVID vaccine. And then I started talking about long COVID, and he was like, "Dude, the last 3 years I've had extreme fatigue. Like it feels like I have 1,000-pound like lead vest on all the time." And I'm like, "Yeah, dude, it sounds like you have long COVID." He was like, "Dang, no way." It was crazy. He literally said, He was like, I came in here to troll you, but that you've really made me think about getting the vaccine in the future. So you got to you got to do it for your kids, man. You got to do it for yourself too. Oh wow, Marissa, that's interesting. Could you send me in the direction of research? It's just um the Iwasaki long COVID. Yeah, you just want to put Iwasaki long COVID. That's like the search term. Iwasaki's the Yale Medical School professor that does all the long COVID stuff, and it's tons of research out there on long COVID now. We haven't gotten a cure yet, but it does. There's lots of yeah, that happens. Exactly, Tracy. Yeah, you just get your flu. You get your flu. You get your COVID booster every year. You get them at the same time. There's no reason to think anything else, guys. Sponge, I would say that they're bad parents, and that's not a good thing to do. You're making a bad decision already if you're not vaccinating your newborn. Yeah, I mean, it's just insane. Oh yeah, dude, that can happen, Marissa, with those IMs. They can hit a nerve, and you're like, ooh. But then you have like the good, someone that's really good with it, and it all goes right into the adipose tissue, and you're just like, oh, it's fine. Or just maybe like a shallow IM, and it's all good. Should I get Tdap if I'm going to be around a newborn? Yeah, Mila, they do recommend that. Yeah, they do recommend for my when my wife was pregnant, they recommended a Tdap booster just because of whooping cough. So you do usually get a Tdap just in case. Nice. Yeah. Yes, Eileen. Yeah, exactly. You don't even question it. It's just easy. It's an easy yes. It's an easy win. Yes, Sponge. Yeah, there's a recommended vaccine in a vaccine list for any type of like international travel, and you just definitely want to get it. Yeah. Yes. Yes, Shauna. Exactly. Yep. Yep. I made all my grandparents quarantine. They had to quarantine with two negative COVID tests over 5 days in order to actually see our newborns because it was like before the vaccine, and then so it was very very tenuous, and I wanted to make sure that we were safe. So we're not messing. We did not mess around, and they were like whatever hoops you wanted us to do, we're down, So yeah, exactly, silly goose. Absolutely. Get the Tdap if you're around a kiddo. It's good. Can you explain why some people say not to get the newborn Hep B vax? Well, why you should? So yeah, basically, Dan Friedman, it's because the United States doesn't have really good prenatal screening care. A lot of people don't do their prenatal care and get all their tests done. So what happens is that they show up in the in the ICU or whatever with with the baby being born, and they don't necessarily have their Hep B done. And it's what's happened is that it's a window that it takes a couple days to get back, and then we have to deliver the baby. So the number one way that you get Hep B is through the birth canal, from being born. So what you do is you just vaccinate that child because it helps fill in that gap. And also, if the baby gets Hep B, it's as a child, it's a 90% chance of being a chronic lifelong infection. If you get it as an adult, it's a really low percentage chance. But if you have it as a child, it's a really, really bad thing. So the idea is the Hep B vaccine not only helps fill in those gaps of prenatal care that we kind of don't fund as a country, and additionally, it protects you during the most vulnerable time of your life when you don't have the immune system to support, fighting off a Hep B infection. So that's why it's safe and effective. So that's why the newborns get the Hep B vaccine. Can not getting vaccination cause cancer? Well, with the HPV one, yeah, the HPV vaccine is anti-cancer. So that's definitely one that you want to get if you don't get it. And guys and gals should be getting it. So that's a good thing to get. Yes, and Kathleen, that's a good point. Mom can also have a false um, negative. She could have a false negative early, and yeah, so she would be positive, but then the test would show negative, so it'd be a false negative. Yeah, exactly, Jude. So most of the diseases kill kiddos because they don't have a fully functioning immune system. So that's why they get vaccinated in order to help establish that immune system. So that's yeah, I got you, Kathleen. Yeah. Oh, thank you for the gifts, guys. Thank you so much. I appreciate you. The live is freezing. Is it freezing for anyone else? Yeah, hello for sure. Yeah, it is. It definitely is. It is freezing. It's a spike, not for me. Okay, okay. It no freezing. Okay, cool. Thanks, guys. Hi, algorithm. Okay, thanks, guys. Thank you. Don't let people kiss your babies. That's actually a really good point. Yeah, baby, it is very true. Is it still worth getting HPV if older? I think it's 45 is the cutoff. 45 is the cutoff for HPV. So I think that's because you've most likely been exposed at that age. But Mercy should yeah, ask someone. I'm not 100% sure. I guess you could get a titer to see if you've been exposed. Do you like neurobiology? I think it's interesting. I mean, I'm a microbiologist, so but I've had friends, and I like genetically modifying stuff and changing things that way. So, but neurobiology requires like an organism that's more developed, multicellular. So that's the kind of the problem. And but yeah, that's why I don't work with neurons specifically. But in general, I think that it could. I wouldn't shake Trump's hand, so I don't know why I would let him anywhere near my child. So, Penny, what did I miss something, Penny? Do. Just got a fluid shingles vaccine. Nice, but got terribly sick. Is that normal? Oh, nice, Penny. Let's two vaccines for you. 791, Penny. Let's give her a big shout out. 3, 2, 1. Nice. Nice, Penny. Good job. Yeah, so what's happening is that your body is creating antigens. So antigens are like the training dummy that your body uses in order to practice onto the nasty virus that it's going to see in the world championship coming up. And in order for your body to train, in order to become a world champion, it has to practice on those practice dummies. And by practicing on those practice dummies, it gets worn out, it gets tired. And that's what happens is that it goes through the motions, it goes through the workouts, and that workout is increasing your body's temperature, and you're not actually having an adverse side effect, or you're not even getting sick actually. It's just your body's natural immune system working and practicing. So you're all good, you're safe, and you're healthy, and you did the right thing. So the shingles one is supposed to be pretty good. It's supposed to be a pretty good training dummy. So you're going to be, but apparently shingles is like the worst thing ever to have. So I'd be happy that you got it. I'm a book that got the J&J vaccine because I work in healthcare. Oh, nice. Cool. Algorithm of a heartbreak. Nice. Okay. Yeah, Marissa. Interesting. Hi, Evelyn. How's it going? What's the earliest age you can get your PhD? I mean, I guess you could like start. I've heard of people that are like 25 getting their PhD. So they're graduating their undergrad at like 21, and then they do a 4 or 5 year program in their PhD. So like 25. I actually know someone that's like that. It's super rare. I would not recommend it, even if you could get it at that age, because it's just you're not even you're not spending enough time in the field and in the research in order to kind of know what your real passion is yet. You need to spend some time to figure out some stuff out. You can't just go school to school like that. And yeah, I wouldn't do it. Oh my gosh, STLA. I don't know. I would, thank you, everyone. Thank you. I don't know. They're both so bad. They're both deleterious mutations. So I would not think so. Yeah, exactly, Marissa. Yeah, I would not. It's kind of wasted. I mean, the saying is education is wasted on the young. You know, you don't understand what you're missing, and you don't understand how what an incredible opportunity it is to be educated and spend that time learning. And I would spend some time to chill. You know, I would take a year off. It's all good. Genuine question: could you go to medical school as of now? I could theoretically, but I mean, I wouldn't want to. But you know, people can. Um, when your immune system is not in top shape, you get more of an immune response. Oh, interesting, Mela. I don't know. I don't know if that's 100% true, but yeah, maybe that makes sense to me. I have no idea, Sponge. I don't know. I'm not really good at standardized tests because I think too much in the weeds of like, oh, this one could be real, but this one could be real. I get all those trick questions. I get them all wrong. So I just, yeah. No, nice algorithm. When did you get these? How many vaccines did you get, and how did you get them recently? How many bacteria types are there into your guts? That's a good question. I don't know. Um, I think that you're 50% microbe. So if you took all the cells in your body and you just said microbe, human, it's a 50-50. You are half microbe, half human. So we're talking a lot of microbes. So I don't know what the diversity is. Though I think that I've heard of over like about 20, 30, I would say. Oh, nice algorithm, nice. The trick questions are the best for us that are on the spectrum. We think too much in. Yeah, maybe I'm like I constantly get tripped up on those. 10,000 different kinds. Okay, cool. That, I mean, that's not surprising to me. I don't think that's. I don't believe it, but I mean, okay, that's a lot, but maybe. Let's see. Let's see. Gut microbiome diversity. Let's see. Gut microbiome genetic diversity number of species. Okay. Yeah, the human gut harbors vast genetic diversity with over 1,000 to 3,000 bacterial species. Okay, I was completely wrong. Although a smaller set of species, around 50 to 100, forms the core microbiome shared by most people. Ah, okay. So that's what I was thinking, the 30. Because I see the gut microbiome, and those are the printouts that I see. So they're not putting 1,000 on the things, but. So, are you a medical technologist specialized in microbiology? No, I'm a microbiology PhD. I've worked a lot in biotechnology companies, but I don't do medicine. I'm not a physician, so I'm a scientist doctor. I've read some scientific articles about 10,000 bacteria types found in humans. Okay, cool. I mean, it's not surprising to me, but I've but okay. Yeah, it is. It's a lot. It is a lot. Yeah, baby. I mean, the problem with probiotic stuff is that it's just a lot of times it's just it's called lysate. Lysate is the what you had, and if you just popped open a cell, so you have all the proteins and building blocks for a bacterial cell. If you just pop open a bacteria cell, right? Um, what happens is that they sell you cell lysate, and they say it's like a probiotic drink, but really it's a prebiotic. So a prebiotic is just bacteria food. An actual probiotic culture will be cultured microbes. So you have live culture in there. And that is what you actually want. You want something that is actually like working. Otherwise that like prebiotic stuff just gets absorbed really quickly and it doesn't really do anything. Yeah, exactly. Yeah, yogurt and stuff like that has actual microbes if it has an active culture in it. Yeah, okay. Yeah, I don't do any type of medical microbiology. It's a cool idea. I mean, I love the idea of using um, microbiology for that, but I don't. Yeah, I don't do that. I definitely yell at all my patients. Definitely do. Are you an introvert? No, I don't think so. I like to talk to people. I like to meet new people. I mean, it's one of the reasons why I like to do this. So, yeah. After your daughter got C. diff, oh man, that's a bad time to get it. But yeah, it's true. Oh, Dr. Phil. Okay, all good. All good, Jude. You're all good. It can be tough for during chat, so I don't you're fine. Um I don't think so. The bread has already been so baked, and it's like I don't think that bread necessarily has active cultures in it. What is the best probiotic? I don't know, Mila. That's a good question. I don't know. I don't have unlike the actual grifters on this platform, I don't have I don't have the Dr. Greg microbiology probiotic on the TikTok shop. Get your probiotic here. That's what those ivermectin boxes of the Dr. Greg special. You want to be smarter, tougher. Get your Dr. Greg special. Exactly. Got that freaking guy like yesterday with the supplement shop online coming in here. Can you imagine that guy was talking about how pharmaceutical companies can't be trusted because they make profits off of the drugs that they sell. And the dude literally has a TikTok shop full of the supplements that he sells. And then he also has a Cash App where you can pay him and he will send you supplements directly. Nice to meet you, algorithm. All good. Yeah, have a good one. Have a good night. It's just wild to me. Yeah, kimchi, that's a good one. Kimchi and stuff like that. Yeah, I know. And then he went all Zionist brain and I had to bam him. But yeah. What a day. All right. Well, sauerkraut, any type of fermented stuff is a good idea. It's just a good idea. Fermented foods that aren't baked. That's the big thing. You don't want them baked. Yeah, he's on his own supplements. Exactly, Alan. He's on his. Dude, the guy was obviously on testosterone. I mean, he was like that. It's so funny to me when people are like, do that stuff, and then they're like, no, dude, it's definitely the vitamin D. You're like, bro, what are you talking about? You're slamming gear, and you're gonna tell me that like it's because of the vitamin D that you're healthy? Like, get out of here, dude. Like, you're just. So funny, man. It's so like people are they lie so shamelessly. Um, it's gross. It's gross. I hate it, but it's yeah. All right. Well, thank you for the gifts, man. Thank you so much. I appreciate you guys. So, gonna react. I'm a react streamer, guys. I'm a react streamer. Just kidding. If anyone wants to talk, let me know. But nice, Eileen. Yeah, I mean, like, guys, I genuinely on all the supplement stuff. If you do blood work and you have a micronutrient that you're low in, for sure, add it in. For sure. You know, like that's what I do. I take vitamin B, vitamin D, magnesium because I like to sweat a lot, you know, and work out. Um, Fish oil hasn't really been proven to that, unfortunately. Um, you know, but you know that stuff is it's because I was on, you know, I have my blood work coming back and I have my micronutrients are low in those steps, so I just fill those holes in. But if you don't have a vitamin D deficiency or you don't have a vitamin B deficiency because you fill that with your nutrients, what's going to happen is that you just urinate them out. So I mean, you're wasting money, but I mean it's probably not the worst thing, you know? It's like you're just wasting money. But yeah, he's debate. He talks about it, debate doc. He talks about being on TRT. So, yeah, it's crazy. Fish oil was like the idea. That's another one, guys. Honestly, something that I've done recently in order to get my like grams of protein a day, I've been canned fish. It's been amazing. I do a cat. Oh, interesting, debate doc. That's a good point. Thank you for saying that. I have started eating a canned fish with some crackers. So canned fish, crackers for my lunch, and that gets like all those fish oils. It's also like 30 grams of protein, which is all you can really assimilate in a meal. So that's like 30 to 40 grams. I get that done. Boom. It's all good. Yeah, creatine is another one. I've been macro dosing creatine for a little bit, like 15 grams a day. I've been trying that out. Helps with like the light sleep nights. Um, yeah, that's I take creatine with my protein shake every day. So that is something that a supplement that I'm taking on top of that. Yeah, nice Marissa. Marissa's getting dialed in, guys. And honestly, like when I find that when I'm taking supplements, I'm more likely to be working out. You know what I mean? If I'm doing the hard work of like working out, then I do the easy work of like eating right. I feel like it's easier to eat right when I'm working out. So like, and conversely, if I'm not working out, like everything just falls away. So I have to keep on top of it. Nice. Yeah, Marissa. My wife's the same way. So we got like the blackout curtains, the masks, the cold sheets, the special pillow. I got her a pillow that's like cool, like a cooling pillow. It's not one that pumps air into it, but it's just supposed to be help that. Um, yeah, we do it all. We do it all. Body pillow. Yeah. Oh, nice, Marissa. Nice. Yeah, we have a white noise machine. We got to do that. White noise machines are really good. Nice. Nice, Eileen. Good. It does. It does help with the sleep. I mean, you basically magnesium helps you retain water, so you're not dehydrating during your sleep. I mean, that's the idea. I like the natural feel good chemicals in our bodies. They're more important than supplements. Nice, a cooling blanket. Yeah. Interesting, silly goose. Interesting. Interesting. All right, guys. Let's talk about this. I saw this coming up the other day. wanted to go over this. This is like the only guy other than the only person that I've seen that's really engaging other than Gavin Newsom to actually fight back or do anything or say anything. Or Pritzker, who is a billionaire, by the way. So I don't know, but he is the governor of New Jersey. I want to say the governor of New Jersey. Pritzker. So I want to react. Illinois, thank you. Dylan, thank you guys. Thank you. So I wanted to talk about, and he had this little quote that he talked about. Exactly. I'm a little skeptical of that, to be honest with you. But at this point, guys, we got to... At this point, guys, and if we got an anti-fascist billionaire, I'm down. Like, whatever. But whatever. All right, let's see what he says here. This is the mini. This. Here we go.
It's sad, that the people around him are not getting him help, and instead they're just taking advantage of him. And that's what Stephen Miller is. You can tell, his rhetoric is so out of bounds. And then we know that he's the one who is advising Kristi Noem at DHS. He's the one who's advising Tom Homan, who's the kind of immigration czar, deportation czar. And of course, he's the spokesperson for this entire endeavor, including about deploying National Guard into cities. So, he seems like a dangerous individual, and he has.
Stephen Miller, man, he is crazy. And it's, guys, he grew up in like Huntington Beach too, Southern California native, just like me. Blows my mind. He grew up like 30 minutes away from me. Dude's psycho. Grew up probably. I mean, the problem is that Southern California is so diverse. There's so much diversity and amazing culture. I don't understand how someone can grow up thinking that it was a bad thing. It's just crazy to me. But here we go. This is the big
as the power of the presidency, because the president isn't reining him in. And so that's why I'm talking about Stephen Miller. I think that we should focus on his actions. And let's remember, and I've said this for some time, they're not always going to be in office, but they will, other than the president, who's now been given immunity by the Supreme Court.
That's the part that I wanted to talk about, guys. What is wrong with that statement? I hate that statement. What do you guys think? I think it's like he's trying to highlight the absurdity of the immunity ruling. I agree. I totally agree. But why are the Democrats already starting in a losing position? The Supreme Court has said that the president of the United States doesn't have to be beholden to any judicial ruling. So why should the immunity decision hold any precedent? If a new Democratic president came in and decided to prosecute ex-President Trump, who's going to stop him? Tell the president, have the president go after with his DOJ after ex-President Trump? What's going to happen? You indict him, you throw him in jail. That's all the executive branch. What is the president? What's going to happen? The district court's going to stop him? They can't. They've already ruled that they can't. Again, so like, why aren't we playing by the same rules that the Republicans are? Why is the Democratic position starting off on the losing foot? That's what I don't understand. Because we're not playing by the rules anymore. Eileen, I agree with you in a way. I mean, we have to play by the the Constitution that exists now, not the one that was ratified in the 1790s. Like we have to play by these rules, and that's what it is. So, I don't think that Democrats should be going around and saying that, political opponents shouldn't be prosecuted, because that's going to look real awkward in 4 years when we're all saying, you guys got to prosecute these people in the Trump administration. It's the big difference is that the people that Trump is going after aren't criminals, and the difference is that Trump and his cronies and his administration are criminals, right? That is the difference. But they're going to say that they're innocent, right? They're going to say that they're innocent and that this is a both sides thing. So you just say, yeah, we will go after you. This is unacceptable what you're doing. You're doing something against the law. So therefore, yeah, we will go after you. Just own it. Just own it. Don't start off saying that, oh, well, we know that you're immune, so we can't do anything. Like, come on, man. Come on. Yeah, exactly, Eileen. They don't really know how to play. The only person that I know that I think is happening is Newsom. I did, Jude. I think that it's good. Honestly, guys, I'm actually interested in Debate Doc's take here. I think for the vast majority of people, I do think that retaglutide or tirzepatide would actually be better than insulin. I think that we should have a state program to nationalize retaglutide or some GLP-1 agonists instead of insulin production. I think we should price cap Ozempic instead of insulin. I know for type 1 diabetics, like that's necessary. But a lot of these drugs, especially the triple action, the retaglutides, actually they have insulin sensitivity benefits as well. That's why they were originally developed, actually. So I think like price capping and buying in mass the GLP-1 triple actions would actually be more beneficial than insulin. But I mean, while it is what it is. I think that it's a good thing in general. But I hate the focus on insulin, because you're basically down the pathway, you guys. You're 3 steps down the pathway as opposed to helping solve the problem upstream. And there's a lot more benefits to GLP-1 agonists in general. There's been a lot of organ protection benefits that we've seen in some of these studies, and insulin and sensitivity and weight loss, as opposed to just it's kind of like, it'd be kind of like you have a hole in your tire, and you're just like, let's keep pushing air into the tire, and like GLP-1 agonists and stuff like that would be patching the tire, as opposed to like just putting more air into the tire. It's just gonna come out, guys. The insulin, you just put more insulin in there, it's not gonna work. Yeah, exactly, Cindy. Yeah, it's Debate Doc. I'd love to hear you talk. I'd love to hear your thoughts on this one. My wife is like very frustrated with this take, so I'd love to hear your thoughts.
No, it's an interesting idea. I mean, I've heard doctors joke that like, they should just toss metformin in the drinking water.
Unironically, like for real.
Yeah, it's also postulated to have some like anti-aging benefits.
Mm-hmm.
Not super clear on the mechanism, but I mean, the risk would be like there's a risk of lactic acidosis, particularly in those with kidney issues. So obviously you can't put metformin in the drinking water. But for the vast majority of people, probably not a bad move to just get them on metformin early. I think the GLP-1s, I think the manufacturing is vastly more expensive than insulin. So I think that's part of the equation. But I mean, I could be wrong.
I don't know how they're actually manufactured. That's actually a really interesting. I thought that they were just like it was just yeast.
I mean, insulin is typically produced by bacteria.
That was the old. Now
cool.
I thought that they went to yeast production in order to evade the City of Hope faction, because the City of Hope patent, they've like patent evaded it and started putting it into a yeast. That's what I heard. A rumor. I'm not 100% sure. So like, but let me see.
Wait. Yeah.
But that is the original. That was the original City of Hope patent for insulin, was bacterial production of human insulin.
Gotcha. I don't know they did in the East.
Oh,
But I mean, I think that like that's relatively inexpensive. I don't know
yeah.
about the GLP-1s. Um, but so that was like one of my thoughts. My other one was that like GLP-1s kind of fall into the category of drugs that are good for. So I mean, like you said, for type 1 diabetics, it's not going to matter. They need insulin. They don't produce any endogenously. But for type 2 diabetics, the GLP-1 agonists would be up there with, um, like metformin and the gliptins, the like, what are those, like DRP4 antagonists, and the like gliptides and all
Hmm.
those guys. So like they'd be in the category of drugs that are used for individuals with insulin resistance, but who are still endogenously producing insulin.
Yeah.
Um, but like when you get to the point where you're like an insulin dependent type 2 diabetic,
Mm.
like you've essentially your insulin resistance has gotten to the point where it's like overtaxed your pancreas enough that your
Hmm.
pancreas, like that all your kind of um, pancreatic beta cells have just kind of died. They're just not producing like you're essentially on the same plane as a type 1 diabetic at that point.
Yeah.
If you become insulin dependent, like your pancreas is just tapped. So you can't like, and I don't think that's reversible with the GLP-1s.
Yeah.
So I think that like they just kind of fill different niches. Like if you can get people on them early, then
Yeah.
like you said,
Exactly.
like you could patch the tire and try and prevent it from going flat in the first place. But
Exactly.
I think that to kind of extend that analogy, by the time you're insulin dependent, you've been driving on a flat tire for a while and you've completely torn it to shreds,
Hmm.
uh, and there's nothing really left to patch. Um, so I think that having the price cap on insulin is still important because once you're insulin dependent, like there's nothing else that's really going to help you.
Yeah. Exactly.
Um,
Yeah. There's some like exactly. There's the when once it's gone too far, then it's like you're done. But pre-diabetics, I guess, is where really the main
yeah,
point of it.
yeah, because
Yeah.
like
So we're at
metformin,
50.
frankly, is
Go ahead.
sorry. I was going to say like metformin, frankly, like it's helpful and it's a great
Hmm.
first line, but like it doesn't do that much, um, like to really lower your blood sugar. Like the GLP-1 agonists are much more effective,
Hmm.
and also kind of helpful for combating metabolic syndrome, in totality, rather than just the kind of like hyperglycemia component.
Yeah.
So yeah, no. So I mean, I think that like making them more available would be hugely helpful. But I think it would have to be kind of in concert with kind of like ready access to insulin rather than replacing it. Is kind of my take.
Yeah. So 50% of the world's a 2024 review saying 50% of the world's insulin comes from yeast right now.
Oh, that's cool.
Yeah. Maybe it must be like grams per liter or the how I don't know where the switch is. I'm looking at a review 10 years ago and it was 50%, no, 56% mammalian cell lines, 13% yeast, 24% E. coli. Oh no! I'm sorry. This is just I'm sorry. Disregard. That was just a percentage of biopharmaceuticals, not necessarily for insulin specifically. Sorry, this is a better paper. Talk about insulin specifically. Yeah, I think it's just they have better engineered cell lines now.
That's cool.
Yeah, and it
I didn't
gets
realize that there
away
was a
from that
patent
patent.
specifically on the like bacterial production. That's kind of
Hmm.
wild.
Yeah. Oh, folding stability, all the precursors. Yeah, there's like more of a system that you can make with yeast, more complexity. If you get that right, then it kind of makes sense. And there needs to be so
That
many.
does make sense because there's so many different types of insulin that people
Exactly.
don't don't really know like that there are there's regular insulin, but then you've got a bajillion types of like long acting and short acting insulin and all that kind of stuff.
Yeah, it's those cofactors that they can like put into this pathway now.
And that's possible because of the yeast versus the bacteria.
That must be it.
That's cool. That's very cool.
Yeah, in this review, we illustrate how molecular engineering can be applied as a powerful tool to adapt insulin precursors for efficient recombinant expression by introducing removable molecular elements, especially in the form of C peptides and N-terminal extensions.
Yeah, which are the things that I think like aid in the like long and short acting formulations.
Yeah, it's cool.
That's really cool.
Interesting. So yeah, I think we have to, honestly, man, like what is it? 60%, 60% of like people in the United States qualify for GLP-1 agonists. So I feel like it's just kind of like, it's the no brainer, man. We have to have like so much of this stuff. So
yeah, no, I agree. They're definitely like a revolution really in pharmaceuticals.
Yeah, I totally agree. All right, man. Well, thanks for coming on. I appreciate it. Appreciate you
yeah, for sure.
as always. Have a good one, man.
You too.
Peace. Oh, interesting. Hi, Eileen. How's it going?
Hey.
Hello.
So I just wanted to tack on to what Debate Doc was talking about with the GLP-1s and everything. So I personally tried the GLP-1s for weight loss and everything, and I did see the results. But like Jenny was talking about, went to the ER, was told to never take it again, worst I've ever felt. Jenny, my question to you would be, did you follow like to the letter the instructions from your doctor as far as dosing and everything goes? Because if you don't like gradually, and I mean like extremely gradually step up your dosage on those GLP-1s, because I had an experience where I stopped taking them for a while and then I like went back on it and I gave myself like a way too high dose for having not been on it for a long period of time. And I got like extremely sick. And it's like, yeah, these GLP-1s, they're extremely effective for treating type 2 and for treating obesity and things like that. Like, so it's kind of, my point is that, you have to really just like be very careful about following your medical provider's instructions on how much to take and when to take it and everything, because like they started me off on like a 0.5 mcg dose and then like gradually over a several month period stepped me up to that 2.5 dose, and then I like stopped for a while and then took that 2.5 dose and got like really sick. And I think that might have been what happened in Jenny's case. And so I just wanted to get your thoughts on that.
I don't think that the starting dosage should be 2.5. I thought it was like 1.
No. So that's what I'm saying. Is like my starting
the recommended
dose.
Starting dose is Zepbound for the injected is 2.5. Okay, interesting.
Yeah. So like my starting dose for Ozempic was like 0.5, right?
Yeah.
And I was taking it purely for, I didn't have any precursors for diabetes or anything like that. But I was overweight, right? So they gave me the 0.5 to start, and then gradually over several months stepped me up from the 0.5 to 2.5. And then I had a gap in between like being prescribed the 2.5 and then taking the 2.5. And then I got really sick from it because I had been so long off of it. And my body was like, it went into shock and it was like, oh my God, what is this? And then I got really sick. So that's what I was asking Jenny is like, did you take too high of a dose without building your tolerance up, which is what you should be doing with these GLP-1s?
Yeah.
And that's what I was getting at is like, a lot of these insurance companies and pharmaceutical companies are monetizing these GLP-1s to the point where, you have people like me who are not diabetic yet, but are in danger of becoming diabetic if we don't get other things under control, right? And so then your issue is like, I need to get on these GLP-1s to get the other factors under control to avoid becoming diabetic.
Mm-hmm.
But then the insurance is like, no, we're not going to pay for anything unless you're diabetic. And then you're left in this like position where it's like you can't afford the medication that prevents you from becoming diabetic. And so, but yeah, my point is like for Jenny especially, it's like, you have to really follow your doctor's instructions extremely closely, especially when it comes to these GLP-1s, because they can make you very sick very quickly if you don't, listen exactly to what your doctor says. Like, these are the dosages you need to take, and you need to gradually step up the dosages.
Yeah, you can still. Yeah, it's true. She's saying, Jenny's saying that she was the starter dosage that was given two of them, and it was the 2.5. That was the starter. Honestly, might qualify for a smaller one. I don't know if they should give you smaller amounts. So
yeah, a 2.5 is way too high for a starting dose, and from my personal experience, because like I said, I started on the Ozempic, and they started me in a 0.5 on my very first dose, and I was on the 0.5 for a full month before they even stepped me up to the 1, and it was like every month over time, like I had to wait a month in between, and they would only step me up 0.5 per month.
Yeah, Zepbound's tirzepatide, so it's a little different, but
it is, yeah. Tirzepatides are definitely different than the GLP-1s and the Ozempics, but still, I feel like 2.5 is just too high of a dose for your very first experience with a tirzepatide or a GLP-1 is what I'm saying.
Yeah, they're both. Tirzepatide's a dual action, so it has dual GLP-1s, and then Ozempic is a single action. Hey, Ducray.
Yeah, so like you can see here, Jocelyn is saying 2.5 is insane, and I agree. 2.5 is just way too high for a very first dose of someone who's never been on a GLP or a tirzepatide.
Yeah.
Like, I feel like that person, like Jenny, at the very most should have been on like a 1.0.
Oh no. Roger. All right. Thanks, Eileen. I appreciate you coming up. I appreciate that. Thanks. I'm happy that it worked out for you and it's working. So
yeah, for sure. I just wanted to offer that. Yeah. I just wanted to offer that insight on that. And of course, like I said earlier, like, we're 100% like that pro-vaccine in this house. And nice. I really appreciate all your like putting out there and all the things that you're trying to educate people on, because at the end of the day, like I was saying before, the side effects from the vaccines, like the opposite of that, which is basically the symptoms of the viruses that you're preventing with these vaccines, like those far out the risks of getting those viruses or those illnesses or whatever, those far outweigh these side effects that you get from the vaccines. Like I got COVID. I got the COVID vaccine when it very first came out in 2021.
Nice.
And I'm now like 5 times vaccinated against COVID.
Nice.
And so for me, it's like I've had a couple of quote adverse reactions to the COVID vaccine, but I will say that those adverse reactions were very minimal, lasted for 36 hours maximum. And I would rather have 36 hours of feeling a little versus I've had COVID since I've been vaccinated. And it's like, I even had probably the worst experience with COVID in late August. And I hadn't been recently vaccinated against it. And of course, once I like fully healed and I talked with my pharmacist, and he was like, yeah, it's okay to go ahead and get the vaccine for, the upcoming season. But I will say that I would highly prefer the side effects that I had from these vaccines recently versus the actual virus, because it's 10 times worse. And like the Tdap thing that we were talking about earlier, like I have 5 children, and every time my doctor was like, make sure that you, your husband, and anybody who's going to come into contact with your newborn in the coming weeks needs to be vaccinated against the Tdap. And I'm so glad we did, because, you know, I've seen the results of not getting the Tdap. I've seen what happens to newborns if they get the whooping cough. It's, for me, it's like I can't comprehend and can't fathom how these parents justify not protecting their children against these life-threatening illnesses.
Exactly.
Like the iron lungs from polio in the 50s and 60s. Like, I just don't understand it. My mom's a little bit older. She was born in 1950. So she witnessed friends and family getting the worst cases of polio you could possibly imagine. And it's just like, she could never imagine a world where vaccines didn't exist and didn't save people from these life-threatening illnesses. And so for me, it's just like, it's so hard to see, you know, friends and family who are my age, you know, deny the efficacy of vaccines and the vitalness of these vaccines in our lives to save everyone in our lives, our loved ones, our family, our friends, from life-threatening illnesses like this. Like, I just got my 13-year-old son vaccinated against HPV at his annual exam, and like the doctor asked me, they're like, "Are you okay with us giving him the HPV?" I said, "Yes, please take care of it. I don't want to risk anything with my children. Like, they're my heart and soul." And I would step in front of a bus from them, and I would, you know, give them a vaccine and take the risks that the vaccine has an adverse effect over the possibility of them getting whatever that vaccine is preventing.
Nice. I love it. I totally agree. Yeah, you got to be able to help your child live in a world where they're exposed to the least amount of threats as possible, right? So
Yeah,
it's crazy.
It's so crazy because, like, you know, I'm probably pretty close to your age. I'm in my 40s, and you know, me growing up, my parents never once questioned getting me my, you know, recommended rounds of vaccines when I was in the 80s and early 90s, right? And you know, nowadays I have parents who are my age who have younger children. You know, some of them waited till their 30s to have kids. I started young. But, you know, it's just like, our parents didn't question it. They just did it because they knew it was the right thing to do, right? But then now you have the late 20s, 30s, and early 40s parents who are like, "Oh, are these vaccines safe?" Yes, they're safe. They've been safe for 40, 50, 60 years. Like, come on. The reason why, because I'm in Texas, like I mentioned earlier in the chat, like, I'm in DFW, so it's not as bad out here because we have a lot more enlightened, intelligent people here in the Dallas-Fort Worth metroplex. But, you know, in the smaller areas like Lubbock and East Texas and things like that, you have these outbreaks of measles, and they think it's like the chicken pox. Like, you know, when you and I were growing up, our parents were like, "Oh, let's take our kids to these chicken pox parties. We'll get them exposed to the chicken pox, and then they won't ever get it again."
Yeah.
Well, they were half right, but now we're susceptible to shingles. And so, yeah. And so it's like, now I have to worry about shingles when I'm, you know, in 10 years from now, when I'm in my 50s. And so, you know, my thought process is, it's like, I'm so glad that even my oldest child, who's 19 and in college now, like, she was still protected against chickenpox, and all my other children are protected against chickenpox because I got them the vaccine. And they don't have to worry about shingles like I do. Yeah. And so it's just kind of like, I don't understand this thought process of parents that are my age or a little bit younger than me, who are just like, I'm willing to take the risk that the vaccine is more harmful than the disease.
Yeah, exactly. Totally agree. Yeah. Thank you so much. I love it. Thank you for being a good mom. I love it. Thank you for looking out for your kiddos. My kids appreciate it too.
Yeah, absolutely. Absolutely. That's my thought, is like, at the worst case, I don't want my kids infecting other kids.
Mm-hmm.
You know, because there's kids who are immunocompromised. There are kids who have cancer. There's just so many things that my sister has CVID. I don't know if you're familiar.
Mm-mm.
So common variable immune deficiency. It is basically a genetic version of HIV, basically. So it is something that you're born with, not something that's sexually transmitted or, you know, transmitted from person to person. It's genetic. And it's basically very similar to HIV. So it diminishes your immune system. It makes your immune system work 10 times harder to fight off and you know, kill off. So my sister basically, like, she get a cold and her cold would last 2 times longer than the average person. Things like that. So her immune system's she's immunocompromised basically. And I'm at this point in my life, I'm getting sick more often than I normally used to. I'm starting to be more susceptible, and when I get sick, my illnesses last longer. So I'm starting to feel the concern that I might need to see an immunologist and find out if I also have the CVID gene. But anyway, my point is, you know, there are all types of people out there who are immunocompromised, whether from illness like cancer or just genetic immunocompromisation.
Mm-hmm.
And so it's our responsibility as healthy individuals to protect those who cannot protect themselves, who cannot get vaccinated because they're immunocompromised, because they have cancer, because whatever reason. Like, the only reason to not get vaccinated would be a medical reason. I don't
Gotcha.
agree with like personal reasons for not getting vaccinated, religious, etc. Like, I feel like the only reason to not get vaccinated should be a medical reason.
Exactly. The personal and religious exemptions shouldn't be allowed. I mean, it's just crazy.
No,
It is.
I agree. I think the fact that they're allowed in the United States is just ludicrous in my mind. Like, I just think that, you know, at this point, especially after we've experienced COVID and we've gone through what we've went through in the past 5 years, just how can you be a contributing member of this society, of the world society in general, just not just America, like the entire world? How can you contribute in a positive manner to this society without being conscientious of the fact that if I am a healthy individual who can get vaccinated and prevent the spread of deadly diseases, like, how can you be that person and not subscribe to doing whatever you can to prevent the most vulnerable of us from getting these deadly diseases?
Exactly. I totally agree.
Sorry,
you,
I'm preaching to the choir at this point.
You're all good. You're all good. No, it's
Yeah,
important.
yeah.
I know. I totally agree. I totally agree. Yeah.
Yeah, it's sad, and guys like RFK, like you were saying, he just immediately like turned course as soon as, you know, the evidence came out and was like, oh, okay, yeah, vaccines are safe, vaccines. But it's just like, you know,
What? Jen Lynn, what are you talking about? You barely hear kids getting measles now. There's tons of. We have a big outbreak in Texas.
in Lubbock, Texas.
It's a lot huge. Yeah.
Like, come to Texas, Jen Lynn, and you'll see exactly what we're talking about.
Yeah, we were literally covering it. So yeah, that's what I'm going to cover, the measles outbreak in Texas right now. So thank you, Eileen, for coming on. I appreciate you. Thank you. I appreciate you so much. So thanks for speaking the truth and talking about it. So I appreciate you coming on. Bye. Have a good night. All right, guys. All right. Why isn't this coming up? It's so weird. It's not coming up for me. All right, guys, it's tirzepatides and Zepbounds are different drugs than Ozempic. Okay, so the starting dose of tirzepatide or Zepbound is 2.5. That's the starting dose of Ozempic is 0.25. Okay, she just got a little mix up. It's totally okay. It's totally fine. And if that's the starting dose, someone had an adverse side effect to the GLP-1 agonist tirzepatide, If it was a big thing, maybe you should explore another one. It's not that big of a deal. If you really need to, by a physician, you could be recommended retatrutides or Ozempic or something like that if you have an adverse side effect. But we're not going to spend the next 30 minutes talking about those starting dosages of GLP-1 agonists. I'm sorry. Okay, so it is what it is. They're different drugs. They have different starting dosages. Ozempic's is 0.25. Tirzepatides or Zepbound is 2.5. That's just what it is. Okay. Hi, how's it going?
Hey, thank you so much for having me up. I just had a quick question for you. On Friday, my husband and I went to the pharmacy to get vaccines. I was getting a flu shot. He was getting flu and COVID. The pharmacist gave him both injections, but then told me, and I was pretty blown away by this, that he discourages people from getting the COVID vaccine. And I said, can you tell me why? He said, yeah, it's because what we're finding out is that the mRNA is actually going into DNA and changing it. And I know I'm telling you, this is why I'm bringing it up with you, because I'd like you to be rational. And then he also said that it is not very effective anymore and it's doing more harm than good. And so he is discouraging people from getting it.
That is wild.
And I couldn't believe that the pharmacist said this to me. So
That is
I
insane.
asked him, are you getting this from like PubMed? Is it from published articles? And he said, yeah. Well, I've tried to look this up because that kind of gave me the heebie-jeebies. I can't find it anywhere, Doc. So I just wanted to ask you what you know, if anything.
It's so basically you're required in order to go from RNA to DNA with a thing called reverse transcriptase. Happens like super rarely for like really weird conditions. It's not a big thing. It's like it happens, and there was a study that happened with cell tissue culture where they said that when they saw that some of it was integrating, but they've never shown it to work with any actual human cells or anything like that. It doesn't integrate into your DNA at all. So it's just most of it is translated into the in the cytosol. So you don't even, it doesn't go to, most of it isn't going to be making it into the genome of and into the DNA. It's just not true. It's wild. I mean, and long COVID is real. Long COVID has a lot of adverse side effects. It's a neurological disorder that we found. Basically, it impacts your, you can get tremors from it. You can get vertigo. You can get loss of hearing and smell. So taste, I mean, it's just, there's tons of problems that we're having with long COVID, and successive COVID infections make you more likely to have long COVID too. So there's just, that's a big reason why you'd want to get the COVID vaccine. Even still for everyone, even the official CDC recommendation right now, because the RFKs, the anti-vax panels have kind of seeped into it, is for elderly people only. And that's,
Right.
I think that's dangerous basically. So.
I agree completely. And I thank you so much for answering that question.
Yeah.
Like I said, it just really blew my mind that it came from a pharmacist, and that's really what made me uncomfortable. So
Hey,
thank you again. I truly appreciate you.
Honestly, it was the PhDs and the MDs that were giving out bad advice during the pandemic that made me have to get into this and like fight scientific disinformation during the 2021. So so I'm not surprised to see people with degrees saying bad things, and the sad thing and the problem is that once you have those credentials next to your name, your opinion seemed to be more valid. That's why I have doctor in my name, right? Obviously I'm playing off of it too, and but the reality is that it's actually not the doctor next to my name that gives me any credentials. It's not me personally at all. It's the studies and what I'm having behind it. So that you're exactly right. Where it's, you know, what studies, what publications are you talking about? The fact that he didn't have those and wasn't well read enough in order to have the specific ones shows that he didn't read those. He doesn't understand them, because if you're at an actual like scientific level and literacy, you can cite publications very easily, actually, because you understand them well enough that they're like pretty cemented into your knowledge, so that you have a pretty well like library of knowledge that you can cite. Like, you know, I can talk to you about, you know, Picard 2022, Warby 2022, Picard 2024, Chris Christoph 2024. You know, these are all seminal papers of, you know, zoonotic transmission of SARS-CoV-2 and at the wet market. You know, not because I've like memorized those names, but because I've read the papers and I understand what's in them, and so I know what's going on well enough to easily understand the name. So the fact that he doesn't have a publication to even cite on something that's so contradictory to mainstream science is pretty telling. But you wouldn't, and you did the right thing. You asked him the question and he didn't have the answer. So
Right. So I went home and I did the research because I thought, oh
yeah,
my God, what did he read that I didn't? I don't see anything anywhere. I don't know what he's talking about.
yeah,
But you're right. You know, it's like I had said in the chat earlier, I'm a nurse. I'm licensed in all 50 states.
nice.
And so, you know, I've been dealing with this junk for years myself. And the whole thing with, oh my God, RFK and the autism thing. You want to talk about
Yeah,
blowing everybody's minds. I'm blowing out of the water with that. But there were studies I could cite where we've looked at Tylenol, and it has nothing to do with it. I don't
exactly.
understand. Anyway, thank you so much for your time. I really
Thank you.
appreciate you.
Thank you. I appreciate you. Have a good one.
You too.
Yeah, guys, that is so frustrating. That is so frustrating, because it's like, what are you supposed to do? That's the whole point. And, you know, people, that's what I hate to say it, but I mean, I don't think that, I do think that people should be losing their licenses for giving bad advice and stuff like that, because you're actually harming people. You're actually going against the medical community, and people are trusting you because of that license. So medical boards should remove that license from these people. I mean, that it's just it's crazy to me that that somehow people are allowed to abuse that. And you had medical boards doing that. You had the people removing their licenses for giving out disinformation during the pandemic. So the problem is that's so many people's, like, that's their go-to, like, oh, I got canceled, therefore you know I'm legit, kind of thing. It's no publication that's worth anything. I mean, Dr. Rowe, it's just conspiracies. You know, I mean, it's just there are some papers in cell tissue culture if you really wanted to talk about that, but all the long COVID publications are even way worse than anything else. So it's a slam dunk to get COVID and flu every year, guys. It really is. I mean, I'm sorry, but it just is. Anyone that's telling you otherwise is putting you in danger, and the people around you, to be honest. So anyway, crazy. It's so frustrating. That's like literally their job. Like, their job is to vaccinate people. Like, that is insane. Like, I don't, like, what is your point? Like, you're going against, I just hate that. I just hate it so much. Man, that makes me frustrated. Like, their job is to vaccinate people. That'd be like an anti-GMO molecular biologist or something. Like, I don't think that it's safe and healthy to genetically modify organisms. Oh yeah, by the way, my job is to genetically modify organisms. So it's like, what? How are you? I don't know. That's crazy. Oh man, what a weird world we live in, guys. Good. I mean, the problem with that is, like, what other things is he not listening to medical science on that he's not telling you? Do you know what I mean? I mean, this is a big problem. This is a problem with when you're like that. So during the pandemic, my wife was pregnant with our third kiddo, and we had a plumbing problem, and we are like in October. Yeah, we're in October. So she's like just about done here. Like this is the final stretch of pregnancy here, and we have a plumbing problem that we have to have a plumber come in. And I'm like, no way. This is the worst time. This is like peak, like October. Like October was like the absolutely no. It was during back in the pandemic. This is like October 2020, and so we had a plumber had to come to the house, and I'm like, okay, well, we were shut down completely at that point. We had not even left the house. Like, we were getting all of our deliveries, all of our groceries delivered, and we were like wiping them down at that point. Like, we were taking it very seriously because my wife was pregnant. We were in the middle of a pandemic, and I'm like, I wanted to look out for my family. And this guy comes in. This guy comes in and goes, no, not my wife, guys. This is October 2020, during the height of the pandemic. So I'm snipped and my wife is snipped. So if we're expecting, then something has gone very wrong. Very wrong. Okay, guys. So this is during the height of COVID. This is pre-vaccine. So October 2020. And so anyway, this plumber comes in, and I'm like, he comes up, we're both masks. I'm like, this is my first non-family person that I've ever seen in the last like 8 months. He's coming in, and he comes to me. I'm like, dude, this guy's going to be coming from house to house. This is very dangerous. Like, I don't trust this guy at all. He comes. I open up the door, and he's just sitting there, face naked. And I'm like, I'm masked up. I'm like, what are you doing? I was like, you got a mask, bro. What are you doing? And he was like, I'm wear a mask. I'm not going to wear a mask. Like, I don't need to wear a mask. I was like, yes, you do. What are you talking about? And I'm like, and then immediately I'm going, wow, this guy isn't wearing a mask when he's going to other houses. So I definitely don't want this guy coming into my house right now because I don't trust him at all. And he goes, well, I guess you're going to have to find a different plumber, huh? And I was like, yeah, I guess so. Get out of here. You're not coming into my house at all. So, I mean, it was at the time where California had the ordinance of like, you had to wear like a mask, a public mask in public and stuff. So I was like, this guy's going against California state law. I would not trust this guy at all because like, if he's not listening to California state law on that, what else is he not listening to in the plumbing regulations, right? He's probably doing stuff not to code constantly because that's probably a big problem for him. And he probably thinks that it's ridiculous to follow those codes. So like, this guy's a huge problem. And so anyway, it wound up being a huge hassle because we were renting at the time. So then the company that we were dealing with was like, oh, now we got to find a different plumber. But we found another plumber within a couple of days and it was fine. Anyway, well, guess what, guys? Years later, it was found out that management company wound up talking to us and said, yeah, because we were like, oh, did that plumber that we can't deal with, did you guys wind up using him at all? The management company goes, no, we had to stop using him because it turned out all the work that he did wasn't up to code, and we had to send another plumber out to redo all of his work, so it was a huge problem. And I was like, wow, look at that. Look at that. I'm not surprised. I wasn't surprised at all, right? Because people that are willing to cut corners in terms of public health, they're going to start cut corners in terms of their own professions too. They're not going to take that seriously either. So, yeah, it's not surprising. It's not surprising. I thought he was the only plumber. Exactly, silly goose. I'm like, bro. Yeah, well, whatever we need, we'll be fine, dude. We'll be fine. As if I'm taking medical advice from the plumber that comes to the. Oh, Well, dang, you're right. You're right, Mr. Plumber. I'm gonna let you in. I'm gonna let you in, and I'm gonna sacrifice the health of my family. Get out of here, bro. Get out of here. People are so funny, dude. Anyway, I'm proud of how we acted during the pandemic. I'm proud that my family was protected and everyone was safe and born, and we did a good job. I felt like, so I'm proud of it. All right, real quick, shout outs, guys. You guys are awesome. Thank you guys so much. I appreciate you. The last super fan, thank you so much, Dak. I appreciate you. Thank you to all the top gifters. Marlis Dawn, thank you so much. I appreciate you. You're awesome. Kathleen, Eileen, Kathleen, Helen, Cher, Trey Sizzle. Thank you to all the top likers for 100, 1,000, or 11,000, like Cindy Rose. Wow, thank you so much, Cindy. That's really nice of you. Cindy Rose, Injustice Anywhere, Cher, Kathleen, Helen, Keisha, Bailey. Thank you so much. Thank you to all the Patreons too. Mrs. Dr. G, Ado, Call Me Ness. Guys, my LinkedIn. Oh my gosh, guys. My LinkedIn. What in the world? My Linktree has my Instagram and YouTube. So check that out. Those are the YouTube archives and some highlights. So highlight clips. So if you want to, exactly, Silly Goose. I totally agree. Hey, have a good one, Trey Sizzle. Thanks for coming up. I appreciate you. Have a good one. Yeah. So check out Instagram. Follow the Instagram. Been putting up fire on there. And then hit here this little heart too, guys. If you can hit the heart, please. Heart me. Thank you. I appreciate you. All right. Real quick. So we want to finish this thing. Finish this. Let's see what he says. So he was talking about how we can't, other than, he says, right before this, he says, other than the president, who we can't charge because of the immunity decision, which I don't agree with. We should go after Trump anyway because he's breaking the law. So that means that the president of the United States with the unitary executive theory could go after him. He's not immune from the president going after him. No, the next Supreme Court or the executive could still charge him. Good night, Marlis. Thank you so much. Thanks for being here. I appreciate you. Let's see what he says, though, after this.
The people who serve for the president, including all the way down to ICE agents, can be held accountable when there's a change of administration who's willing to hold them accountable when they break the law. Now, Stephen Miller is clearly ordering people to break the law. So, he should know that, it may be 3 years from now that he is held accountable, but make sure, I think it's important for them to know that whatever they do now, it's not like we're going to forget, and it's not like we don't have a record of what they're doing. It's clear that Donald Trump has diminished capacity, which I think is sad, that the people around him are not getting him help.
Exactly. I totally think, yes, we should, these guys should be told, and we should say, we're going to go after these guys. We have to. These guys are breaking the law. It's insane. They are throwing people in jail, the American citizens in jail. Some of them without a lot of them without due process. Even a single one is too much. Even a single one is too many. And so this is not like a deportation of illegal immigrants. This is them rounding up citizens and non-citizens alike because of their color of their skin and harassing people because of that. And it's cruel and unusual. So therefore it is illegal. It's unconstitutional. So therefore it is against the law. It's very simple. Thank you, Eileen. Thank you. So absolutely go after these people. All right. Next up, This guy. Oh my God. Ugh. Sorry, guys. I'm sorry. All right. I'm sorry. It's wild that he's in his leadership position, and yeah, here we are. It's as crazy as Trump, to be honest with you. Okay. Yes, other Jen, exactly. Yeah, Fifth Amendment for sure. Violation of due process, exactly. Yeah, Lorena, it is. He talks like that because of a disease that he has, so we should be kind in that aspect. But we should be ruthless about the verbal diarrhea that comes out of it. So he has a disease which causes him to have spasms in his vocal cords. But that doesn't mean that he has to speak nonsense and hurt people because of that. So, oh really? I saw like a clip of her like on The View, and it was very odd. It just, I don't know, man. It's you gotta be really. She was just defending him. They were like, he's not a doctor. Why can he go through and say that the entire medical industry is wrong? And she was like, well, he reads a lot. It's like, what? He reads a lot for his own opinions, and he has a really formula. He's done it for years. It's like, what? How do you think that? Like, how do you think that that's a valid? I know. Yeah. Hi D. That's a microwave Mel Gibson. I called him a sack of raw meat that was left out in the sun for a week on one of my videos. It's like, it is bad. It is very bad. Anyway, okay, so here he is talking about how experts, we don't need to listen to the experts. Exactly, Kathleen. How science needs to prove to you through studies what reality is. Lawyers need to convince you what reality is. Do you know what I mean? There's a big difference. Like, lawyers don't necessarily need to convince you of the truth. Science needs to prove to you through science and publications that what the truth is, and then reproducibly recreate that result. So, like lawyers, it's what there's not necessarily a truth fact-finding mission. It is a majority of the time, I would say. I do think that the judicial system is okay, and it is a good thing overall. But not every lawyer is convinced, or not every lawyer is trying to reach the truth, I would say. Not every time. They're trying to prove what the truth is beyond a reasonable doubt. So it's a little bit different. Yeah, the Amish is a good example. So like the Amish is, so basically the argument is like, well, a lot of the same things that we are seeing in the regular population, we aren't seeing with the Amish. Like, do you think that the Amish physicians are really lock in step with the DSM-5? Are they the ones that are really reporting medical issues right at the drop of a hat? I just don't think that the Amish are really good at medical keeping. I'm sorry, but I don't see it. But oh, thank you, Kathleen. Thank you. Thank you, Stars. Thank you. Yeah, Stars. It's tough. Do they have debate doctor? I would assume that they would have some type of medical worker or someone. Do they? I mean, like, do they have like shaman? I don't understand. Like, what do they have? They have alchemists? Like, what do they got? What's Are they doing rosemary tinctures or what do they got? They have like, you need some switchgrass rubbed into that. Like what are they working on? Okay, that's good. That's good. Yeah, witch doctors, yeah. Yeah, exactly, Dr. Rowe. Would they really be honest in their reporting if they really had a bunch? Like, would they? I don't know. I don't know. Okay, Nicole, that's good. I mean, that's the thing is that, like, again, they should be welcome. We're not trying to castigate them. We're not trying to push them out of society. I think that, and that's a great point though. Like science, medicine, physicians, nurses, these are all things that are going to be trying to help you, and they're not going to push you away. Physicians and nurses aren't going to push someone away because they are being untruthful about reporting their diseases to begin with. They're going to help you regardless of how you were before that. So these people that are saying like, they're not reporting COVID cases, right? They're not reporting how many. What in the world? No. Google. So I think, yeah, that was weird. Anyway. All right. So here we go. Let's see what this maggot food thinks. I don't know. Oh, God.
People, we need to stop trusting the experts, right? We were told at the beginning of COVID, don't look at any data yourself. Don't do any investigation yourself. Just trust the experts. And
like, it's so like, why is the pandemic used by these people that never once contributed anything positive to the pandemic? Now they get to, at the end, somehow be this arbiter of truth. Where now we don't trust any experts. Like that's insane. About any other field, this would make no sense, right? This would make no sense. We need to stop listening to mechanics on how cars work. Trusting mechanics is not a feature of automobiles. Would that make any sense? Would that make any sense? Would you trust your friend that is just like you know what I mean? Like that we don't, we need to stop trusting plumbers. Trusting plumbers is not a feature of proper water delivery. I don't know. Like what? Huh? Like in what sense would you ever you get a second opinion on your mechanic, right? Your mechanic says it's going to be $2,000 and you're like, "Wow, that's a high. I'm going to get a second opinion." What do? You go to a second mechanic. It's not like you go to some random person, a painter. You're going to be like, "Yeah, what's a painter think about my mechanic, my car cost?" Why? No, because they don't have expertise in that area. Expertise exists, guys. Expertise exists. I don't understand why people. It blows my mind that people actually think that expertise does not exist when people have dedicated their lives to learning something. I'm sorry, but like they just that's the thing. You can do that. This does happen. People are learned and erudite about subjects. That's not a bad thing. That's not an indictment on people that aren't educated about that thing. It's just showcasing that there is expertise that does exist. Like this guy. This guy's an expert about injecting heroin. That's what he's an expert on for 14 years. So if I had any type of need for expertise in that area, that's what I would go. That's what I would go. That's who I would go with. So, but not for this. But not for this.
Trusting the experts is not a feature of science. It's not a feature of democracy. It's a feature of religion, and it's a feature.
Yeah, it's a feature of religion. I mean, that's insane. Calling scientists religious is just yeah. He's an addict for 14 years. So what he's trying to say is that there's a dogmatism, right? There's a dogmatism within science that you can't be skeptical of it. And that's not true. Obviously, that's not true. If anyone is open and amenable to change, it is science. That, if anything, the pandemic showed us that. The CDC was constantly changing as they had more and more scientific evidence to change one way or another. I think that they were too amenable. Isn't that the whole point? That they were too amenable, that they went back and forth as opposed to being more steadfast as they had to weigh in new studies, new ideas. And then they had an authoritarian wannabe dictator that was trying to push Fauci and the CDC in one way versus in another. They were too amenable. They were changing too much. But now all of a sudden, we can't question them. That's nonsense. That's just nonsense, guys.
Of totalitarianism. In democracies, we have the obligation, and it's one of the burdens of citizenship, to do our own research and make our own determinations about things.
So again, guys, there are bad ideas. I'm sorry, but there's just bad ideas. Everyone's idea is not equal. You can postulate and you can draw untested hypotheses and you could say things, right, without testing. If you haven't done the research and you haven't done the searching through the literature to understand what's happening, and that you can talk about things, an untested hypothesis, but once you've tested that hypothesis, it means more. That idea means more because you've actually tested that thing and it's been proven to be true and reproducible. So therefore, a tested hypothesis means more than an untested hypothesis. That's just what it is. Not all ideas are simple. It's just not true. Exactly, Silly Goose. We were on the same brainwave. Same gander. Is that a goose joke? I think new goose joke just dropped. Yeah, exactly. Okay. Yeah. It's a new goose joke. That was a good one. That was a good one, guys. That was a good joke. I don't care who you are. That was funny. Oh, man. He did keep a freezer full of roadkill. Very odd. All right, guys. Now we're going to do a learning stream. All right, one second. Nice. We're going to learn. Dude, I'm going to learn what the hell's going on with freaking Texas. Like this outbreak, dude. I've been gaslit, guys. I had heard that it wasn't that big of a deal, and that the anti-vaxxers have been saying that the deaths have been fabricated, just like COVID. So you kind of know that there's been something happening. But also, like, I didn't realize that there were so many cases. It all comes from this, guys. We were doing our due diligence, looking at the CDC, talking about the active measles cases in the United States, and we were looking at this. Okay, and this thing. Well, guess what, guys? I was like, let's look at this is actually doing your own research. Legitimately, this is what actually doing your own research is. Where I was like looking at primary sources, and reading our own, like doing actual primary source reading. Do you know what I mean, guys? Reports. You know, like actual reports. And looking at South Carolina at the 16, because that's what we're following. Because it's an interesting epidemiological study, right? We're in on the first wave and we're trying to understand it. But then I looked at Texas and I was like, 803? What? Wait, what? What? Yeah, 803, guys. 803. Look at weekly measles cases by rash onset date. Look at this. What? Look at how many cases there are. I am like blown away. 2024. Wow, so this is 2024. And then this is 2025. Not good. Canada is close to losing its yes, Courtney. Same with me with the United States. It's like I think one of the guys that I follow was talking about that. Sure. Yeah, the I'll drop it in stream chat on Discord. Here you go. Okay, so I wanted to look at the Texas Health and Human Services, their Department of Health. I wanted to see what's going on. Okay, and this is it. On October 18th, the Department of State Health Services reported the end of the 2025 measles outbreak. It has been more than 42 days since a new case was reported in any of the counties that previously showed evidence of ongoing transmission. The DSHS will continue to monitor the few cases. Okay. As of August 18th, 762 cases of measles have been confirmed. Okay. Wow. Holy moly, guys. Look at how many there are. Look at that. In the Dallas area. Dallas? Dude, they're everywhere, guys. Every major city in Texas. What? Guys, are you seeing this? What? This is unbelievable. What? Look at this. Look how much. Look at all these cities, dude. Look at this. This is insanity. It's everywhere. And they declared it over. Yes. I don't understand. They've confirmed 800 cases, which is 40 more than when they declared it over. So obviously there was new cases. It's been 42 days since the new case. Okay. They said as of August 18th, 762 cases were reported. They're saying there's that, but then on this page, on the CDC's own page, they're saying it's 803. So that means that there's 40 more cases since August 18th. That's been a month. We're looking at the CDC pages here, but this is the Texas's own Department of State Health Services. So this is their own, guys, we're looking at primary literature, primary source data here, right? Finding a provider. So providers here. Do they have, so the other one, South Carolina had a good, so let's see if we can find, let me see if I can find a I want to see if I could find. I want to see a press release or a video of them like talking about this. Texas Department of Public Safety. No, yeah. State Health Services. Measles. Do they have like a video? Anything? Nope. They just all these news articles of them declaring it over. Oh, what a joke, dude. What a joke. What a joke. 800 cases. This is unbelievable. I had no idea. I had heard about it, obviously. I never did the searching myself, and that's what I'm so frustrated about. Okay. Okay, here we go. Here's the latest local. Okay, here's the local Texas. Local news is covering it. They're okay. So we're following South Carolina right now, guys, and we're also following. This is the last 5 days. Okay, so we have two. Here we go. Here we go.
The health alert now, more Texas children are showing up to school without the required vaccinations. According to a new report from the Texas Tribune, about 1 in 5 Austin ISD kindergartners did not prove they were fully vaccinated.
1 in 5? What? It's supposed to be 1 in 20 is supposed to be allowed. 1 in 5. So it's 4 times worse. That is wild. That is wild. You have a 90% chance of becoming measles positive if you are unvaccinated.
Against measles and did not file for exemption. Their analysis shows across the state, measles vaccinations has dropped to the lowest since at least 2011. The Tribune attributes the drop to children falling behind on their immunizations during the pandemic. The report also says access to vaccines.
They have personal exemptions and stuff, Kathleen, but these aren't even people that have filed for that. So it's even worse. It's even worse. Yeah, Nicole, I guess they do. I guess they do in Texas. I guess they just allow you to come to school.
Vaccines has dwindled due to the political influence of vaccines in recent years. And you may have noticed more of your coworkers getting sick over the past few weeks. As Jeremy Baker reports, as we get closer to the middle of fall, that may happen more often as respiratory viruses become more common.
There are 4 common viruses that ramp up in the fall: the common cold, flu, RSV, and COVID-19. And they become easier to contract as we spend more time inside towards the end of the year.
What we're primarily seeing, the number 1 pathogen on our virology report is rhinovirus, which causes the common cold.
The Texas Department of State Health Services Respiratory Illness Interactive Dashboard shows a drop in ER visits from COVID, but an increase in both influenza and RSV through the first few days of October.
Yeah, guys, this is the influenza increase that even the CDC's found in their own data, and that's why RFK's CDC even recommends flu vaccines for 6 months and above. More and more kids that are kiddos are dying to this. Wow, Courtney, wow.
Exactly. COVID has started to decrease some. It's coming down from that summer surge, but but there's still a fair amount of COVID out there.
So how do you tell the difference between these illnesses? When it comes to a cold, the flu, COVID, and RSV, they don't always have the same symptoms. If you have body aches, fatigue, and a sore throat but no symptoms, you probably have a cold.
Cool.
If you have those and a fever, it could be the flu. Add in difficulty breathing and a loss of taste or smell, and COVID-19 is a possibility. But if you have wheezing and difficulty breathing, RSV is a
Guys, the easiest thing is just do a COVID test, guys. Just do a COVID test. It's really easy.
high likelihood.
And the expired tests are fine. You can still use the expired test.
Flu and COVID tend to cause a bit more severe illness. They also tend to have more of the muscle aches, the higher fevers.
For those that have chronic medical conditions, Dr. Bowling says talk to your doctor ahead of time about antivirals you can take if you catch COVID or the flu.
If you do develop severe symptoms, you may be a candidate for getting one of those antivirals that could help you from getting even sicker.
Dude, why is that guy opening his eyes so much? It's very weird. Is this okay? Are they coming South Carolina? Here?
Oh, in South Carolina, 150
okay,
through 3.
This is Houston covering the South Carolina stuff. So anyway, dang man, that's wild. 1 in 5. Oh wow, that's crazy. Dot. Oh my god, dude. Oh, it's really bad. I mean, it's still happening really bad. You have, I mean, what, 153 unvaccinated children in quarantine because of measles. It's just, it's very bad. And 50%, 90% of those are slated to be positive. So we've been watching it. This is the current. Yeah. Mm-hmm. This is the current dosage. So you can see that like South Carolina has 16 confirmed ones, but they're still waiting for those 150 unvaccinated kids to spring up positive before they say. But there's a gym outbreak problem. Nextstream.org. This is United States for monkeypox. Let's see where it is. I don't know. I don't think that we're doing like mass surveillance of monkeypox anymore. So I don't know. Yeah. Yeah, it's bad. It's very bad. All right. Measles. Man, Texas really screwed it up here. That is wild. So they have 40 cases since they declared it over. And they just declared it over. They just declared it over. That was it. Really? How would it be? I thought it was have to be like by contact. They did, Heather. They declared it over August 18th, so a month ago. There's been 4 new confirmed cases. So it is crazy. That is so dangerous. There's not even, oh my gosh, the Department of State and Health Services, it's not even on the front page. What? They don't even have a... What? It's not even on the front page. There's nothing here. Bro, this is like a... What? They're not doing anything. Bro, it's not on their Instagram page. They have no mention of it on their website. They called it over a month ago. They are just completely whitewashing this thing. What? Like where is the any mention of this measles outbreak? 800 cases right now, the biggest in the country by like 40x. What? And there's just no mention of it? 100 in New Mexico is the other highest one. So it says 800 times, like 8 times the amount. What? There's no way, dude. They're literally suppressing this right now. Oh, I'm sorry to hear that, Heather. No, that's the state, the Texas State Health Services. So this is not the HHS. The HHS is not involved at all. That's the problem. That they're just flying. But dehydration, though. They got a little PSA on dehydration. No, Texas. The only people covering this is the Texas. But I don't know how this. Somehow that means that this CDC is more up to date than Texas somehow. Because Texas has 803 and they have 763 before. Do you think it could become a pandemic? I mean, it'd be an epidemic first, right? Epidemic is a local. I don't know what the difference between an outbreak and an epidemic is. It would have to be the exchange of genetic material where you're creating those viral recombinations, and then a pandemic is global. So if this went global somehow from Texas to other parts of the world, and then those genomes were recombining, that would be a pandemic, but it would be epidemic first. Do you know any scientists or doctors there? Like, no, I don't know anyone in Texas. It's born and bred Southern California, so I do not know. I did not know many people from Texas. I know a friend's sister lives there. Do you think it could become a pandemic? I mean, theoretically, yeah. I mean, yeah, for sure. Yeah. I mean, measles is the most contagious disease that we know of, as an R naught of between 12 and 18. So it's incredibly pervasive if it gets out, and that's the problem. That's why the herd immunity was so incredible and so strong in the United States. The rash is the main symptom for measles. Measles symptoms. Exactly, Dr. Rowe. Like, aren't these people? Yeah, fever, cough, runny nose, red, watery eyes, sore throat. So that's just kind of like pretty standard. But then the rash is what is the one that really is the signifier. Rash, which just appears 3 to 5 days after early symptoms, starts as small red spots on the face and spreads to the rest of the body, which may become blotchy and raised, and then typically lasts 4 to 7 days. Yeah. Robert, you could, if you've never got it as a kiddo, you could ask for, just like in general, you could ask for a titer. So the titer would do a screen of all your vaccines to see if you don't have any working antibodies, or if you've missed any, you could just get it all, catch them all. They're like Pokemon. Vaccines are like Pokemon. You want all of them. So. Nice, Heather. Good. All right. A titer. Yeah, TITER. So basically they take your blood and then you get it screened for different antibodies that are there, and you try to see if you have antibodies for the vaccines that you should have gotten. So you over time antibodies wane, and you basically can get a reboost of it. You can never catch them all by design, exactly. Yeah. All right, guys. All right, guys. I think I'm going to call it an early night. I'm going to try to get some extra sleep. And, yeah. It's been fun. Going to try to get some sleep. And get some stuff done tomorrow morning. And I appreciate you guys. I love it. Thank you guys. Thank you guys. That was crazy. I cannot believe Texas is doing such a bad job. I guess I'm not surprised, but man, that's dangerous. Thank you. I appreciate you guys. Thank you guys so much. Thank you guys. Big L, Texas. Big L. Big L. All right, guys. Tomorrow, we'll figure it out. We'll talk more. Thank you guys so much for being here. I appreciate you guys so much. Thank you to all the gifters. Thank you for the hearts. Thank you for being here. I appreciate you. And we will see you tomorrow. Thanks, guys. Peace. Bye. Thanks for coming. Appreciate you. Have a good night. Bye. See ya. See ya, bye. See ya, YouTube. Have a good one, YouTube. I appreciate you. Have a good one, YouTube.